What's happening with quality and safety in checklist land? This research I'm going to share is going to tell you where it's at. So, what if a checklist could do more than prevent errors and instead help patients feel genuinely cared for? This multi-method study examines how the checklist was used in cardiothoracic operating rooms and cardiac catheterization laboratories at a large public hospital in New Zealand, and what happens when patients' voices are brought into the conversation. We used a multi-method design. We combined structured observations of the checklist use with in-depth interviews with clinicians and patients. We observed the checklist in real time during 60 checklist phases in cardiothoracic surgery and 20 timeouts in cardiac catheterization laboratories, assessing quality using the HUBARS scale. That's the behaviourally anchored rating scale. And then we undertook some interviews with 10 clinicians and 17 patients, exploring experiences of safety, communication, and care. What did we find? We found the checklist was used well in both settings. In cardiothoracic operating rooms, the checklist was used in full and scored highly, closely aligning with the WHO model. In cardiac catheterization laboratories, particularly angiography suites, checklist use was more variable and often abbreviated. What did we learn from the interviews with clinicians? I don't imagine there are any surprises here, folks. Clinicians agreed that the checklist is fantastic and they're really glad it exists. It's helped a lot in improving quality and safety. It's valued, it's embedded in practice. And engagement during its delivery, especially during the sign-in, varies. Power hierarchies remain a thing. They are still informing its use. So nurses often found it difficult to gain attention or to speak up. Some clinicians were perceived as merely going through the motions, that kind of thing. So this study highlights that active participation, shared focus, and psychological safety remain essential. What did we learn from the interviews with patients? Patients did not find the checklist frightening or bureaucratic. In fact, they were happy to repeat their name 5 times, to have somebody ask them over and over again, what's the procedure you think you're going to be having here and on which limb, that kind of thing. Vastly reassuring. They experienced it as reassuring evidence that the team was careful and coordinated. Clear communication, repeated identity checks, and being kept informed, especially during procedures under conscious sedation, helped patients to feel safe, respected, and included. So patients are big fans of the checklist. They strongly supported greater inclusion in the checklist process. Based on what participants said, we recommend one small and simple modification, and that's checking and using a patient's preferred name and pronunciation. Patients said this had profound significance on them. This small act can transform the checklist into a moment of cultural recognition, dignity, and connection. So there you have it. The WHO Surgical Safety Checklist is more than a technical safety tool. When thoughtfully adapted and humanized, it strengthens teamwork, improves safety, and keeps person-centered care in focus. Thanks very much for your time.